Hi everyone, my name's Jamie Deweese and this is my video project. My video project is on the following 5 medications: carbidopa-levodopa, acetaminophen, zolpidem, fentanyl, and phenobarbital. For each of these medications, I will talk about the classification, the mechanisms of action, pertinent lab values, indications for the medication, patient education, nursing assessment data, and available forms of each medication. Fentanyl. Fentanyl is an opioid agonist. It binds to opioid receptors in the CNS, altering the response to pain. An indication for a patient to take fentanyl would be to decrease pain or to supplement an anesthesia. Fentanyl can cause an increase in amylase and lipase labs. The nurse should make sure the patient's aware that fentanyl can cause orthostatic hypotension and educate them to change positions slowly to minimize orthostatic hypotension. Patients should not be taking fentanyl long term because it's habit forming. No driving while on the medication, and patients should also be on a bowel regimen to prevent constipation. While patient is taking fentanyl, the RN should be assessing blood pressure, respiratory rate, heart rate, oxygen saturation, and level of consciousness before, during, and after giving fentanyl. Fentanyl is available as IM, IV, and transdermal. Carbidopa-levodopa. Carbidopa-levodopa is a dopamine replacement drug. As we have learned, dopamine works as a neurotransmitter that it's responsible for emotions, muscle movements, and sensations of pleasure and pain. Carbidopa-levodopa works together to get as much levodopa to the brain. Levodopa is converted to dopamine in the central nervous system, where it serves as a neurotransmitter. Carbidopa prevents peripheral destruction of levodopa, therefore more levodopa getting to the brain. A patient would take carbidopa-levodopa to treat Parkinson's disease, and patients should show decreased tremors and shuffling gait, improved mental status, and the ability to perform ADLs. Nurses should monitor hepatic and renal function tests and CBC with differential to determine the need for possible dose adjustment and for evaluation of possible bone marrow suppression. The nurse should teach the patient to take drug as directed and that the medication should not be crushed. Assess for signs of toxicity, which would be involuntary muscle twitching, facial grimacing, exaggerated protrusion of tongue, and behavioral changes. Carbidopa-levodopa comes in tablets and extended release capsules. Zolpidem is a non-benzodiazepine. It produces central nervous system depression by binding to GABA receptors. GABA is a neurotransmitter of the brain and moderates central nervous system activity. By depressing the activity of GABA, benzos decrease the stimulation of the central nervous system, and the brain allows for the patient to rest or sleep. Patients take zolpidem for insomnia or sleep. I could not find any pertinent lab values that we should be monitoring while patients taking zolpidem. If anyone knows of any, let me know. Patients should be aware that they should not take any other central nervous system depressants, as it can result in a greater level of central nervous system depression. Patients should go to bed directly after taking the medication, as it has a rapid onset. The medication can cause daytime drowsiness or dizziness. Nurses should assess for central nervous system depression, and zolpidem is available in a tablet. Also, zolpidem is contraindicated in patients over 65. Phenobarbital is a barbiturate. It depresses the central nervous system by inhibiting GABA, produces all levels of central nervous system depression, including the sensory cortex and motor activity. It also has an anticonvulsant effect due to decreased synaptic transmission and increased seizure threshold. You might see patients taking phenobarbital for insomnia for short term, preoperative sedation, and treatment of seizures. Nurses should monitor the LFT and BUN creatinine because the medication is contraindicated in patients with renal and liver disease issues. The nurse should teach the patient to not discontinue medication abruptly. The patient should be tapered off the drug. If not, it can cause nightmares. The nurse should monitor the labs, respiratory status, pulse, and blood pressure. Phenobarbital is available PO, IM, and IV. Acetaminophen. Acetaminophen is a non-opioid analgesic. It inhibits the synthesis of prostaglandins that may serve as mediators of pain and fever, primarily in the central nervous system. It has no significant anti-inflammatory properties. Patients take acetaminophen PO for mild pain or fever. They take IV acetaminophen for treatment of mild to moderate pain, moderate to severe pain with other opioid analgesics, and fever. Nurses should monitor LFTs. The patients should be aware that there is a maximum daily dose of acetaminophen. Many drugs have acetaminophen mixed in it, so they must know to read labels. The FDA recommends patients take no more than 3,000 milligrams per day, and patients who have liver disease or chronic alcohol consumption should take no more than 2,000 milligrams per day. Nurses should assess overall health status and alcohol usage before administering acetaminophen. Patients who are malnourished or chronically abuse alcohol are at higher risk of developing hepatotoxicity with chronic use of usual doses of this drug. It's known that toxicity of acetaminophen can be treated with acetylcysteine, and available forms of this medication are orally, rectally, and IV. For my resources, I used online F.A. Davis, which was very helpful in finding the mechanisms of action, indication, and labs and nursing assessments for all the medications. I also used our pharmacology book for other things that I could not find on F.A. Davis. I hope you all liked my video. Thanks.